So welcome everyone. This is our third installment of our horse owner webinar series from the American Association of Equine Practitioners. We call ourselves the AAEP. We are so excited to have you here. I'm Karen Pouts, Director of Education for the AAEP, and I'll be the moderator for this session. The American Association of Equine Practitioners is the world's largest professional membership association for equine veterinarians and veterinary students. And there's a good chance that your personal veterinarian is an AAEP member. One of our primary missions is to deliver the latest treatments and research in equine veterinary medicine to our members. This mission extends to providing quality information about the health and welfare of the horse to the clients of our member vets. We appreciate your commitment to your horse by being here tonight. This webinar is entitled Navigating the Equine Breeding Season, Mares. Our panelist expert on this subject is Dr. Dale Kelley. And once we get started, I'll let him introduce himself further. But first, that bit of housekeeping. Please understand that we are not able tonight to answer questions specific to your individual horses. Save those questions for your personal veterinarian. However, we might have some time to answer some broad general questions, and you can put those in the Q&A box. Putting questions in the chat is okay, but the chat's going to roll through so quickly that we might miss them. So look on your screen for the Q&A box, and you can put questions in there. We'll try to get to some of those questions, but again, understand there's a lot of people, a limited amount of time, and we'll do our best. A quick shout out to our man behind the curtain, our IT director, Kevin Hinchman. He's hanging out and making sure we don't have any technical blow-ups. But Dr. Kelley, I think now I'm going to pass things over to you, and I'll remind you to take yourself off mute.
Well, thank you very much. Thank you everybody for being here. I'm going to go ahead and start sharing while I kind of give you a little bit more background. So that's kind of a bit of an abbreviated background that I wrote up. I have, let's see, been in the horse industry most of my life. Let's see, it's like it's working.
There it is, perfect.
I went to my undergraduate at North Carolina State University, and then I spent a few years in the horse industry, training horses, and then went back to school, did a master's at Clemson University looking at reproduction and exercise, and then a PhD at Florida looking at nutrition and exercise in horses. And then I decided to go to vet school at University of Florida. Followed that up with an internship in Central Kentucky and a residency at Texas A&M. And now I'm, an assistant professor at Oklahoma State University. So that's a little bit about me. And this I should preface this by saying equine reproduction is a very broad topic that we could probably spend many many hours discussing. So this is kind of geared really towards people who are not very experienced or have minimal experience in horse breeding. And this kind of comes from some pitfalls, and we'll kind of talk a little bit about what I've actually seen in practice. But I think first, there's always a disclaimer. Kind of the stuff I'll present here are generalizations. If there's any specific questions or anything, please contact your veterinarian, or if you don't have one, develop a relationship with a veterinarian and talk to them about your specific circumstances, because each animal in each case is an individual, and how you go about dealing with each one can vary considerably from case to case. Also, I think the next thing that's important is there are a lot of breed registries in the world. So it's really impossible for a veterinarian to know all the rules for each registry. So I think it's important for each horse owner to be up to date on these registry rules in regards to what reproductive technologies that you can use. So for example, like thoroughbreds, you basically have to do live cover. Other breeds, are much more open, allowing things like embryo transfer, ICSI, and so on. But, it's really, should be your responsibility to make sure that you know what those rules are for that registry, because there's a good chance if you have a very small breed um, that you're, working with, the veterinarian may not be familiar with the ins and outs of that particular registry, and you might have to educate them a little bit on that. So a lot of times, the horse owners I meet that are new to it, they don't understand the basic physiology, and I think having just a minor understanding of it can kind of help with the dialogue with your veterinarian. And this is just a list of some basic terms. So, what we refer to as the estrus cycle is really the period from ovulation to ovulation. And, mares are what we call seasonally polyestrous, meaning they have a certain time of year when they are reproductively active and a certain time of year when they are not. And during that reproductively active period, they go through cyclic phases where they're receptive to a male and then periods where they're not receptive to a male. And that period when they are receptive to a stallion is called estrus. That's when they display signs of heat, such as raising their tail, urinating, and winking. And then they go through a period when it's called diestrus when they are not receptive. So if they're exposed to a stallion, they're likely to kick, bite, or try to kill them basically. And that estrus cycle is approximately a 21-day period. And there is some individual variation between animals, but it's pretty close to 21-day period for most, give or take a few days. And then generally they're in heat anywhere from a few days to about a week, or in estrus. And then diestrus is generally somewhere in the neighborhood of 2 weeks. And then with regards to the seasonality of them, and estrus is that period when they are not in heat. And it's important to think northern versus southern hemisphere, because it's daylight that drives their reproductive season. So in the northern hemisphere, they're generally out of heat during the winter time, and they come back into season in the spring, are reproductively active during the summer, and then go out of season during the fall. And then some other more specific terminology that we'll use is, more specific to what's going on at the ovary. And we'll have a little bit of discussion on some anatomy and some basic physiology after this. But a follicle is a structure on the ovary which basically contains that egg, and the egg is which is fertilized by a sperm from a stallion, and will eventually develop into an embryo, a fetus, and hopefully a foal. And then ovulation is basically that process where the oocyte is released from the follicle into the oviduct where it can actually be fertilized. And that follicle, when it ovulates, develops into a corpus luteum, which is a structure on the ovary that produces progesterone. And that progesterone is actually what is responsible when a mare is in diestrus. So this is kind of showing you a little bit of the endocrinology. It's rather complex, and there's whole courses on just endocrinology. But basically, there's three different areas that we think about. The hypothalamus is actually in the brain. It's a region of the brain, and that sends this hormone called gonadotropin releasing hormone down to the pituitary. And that pituitary gland, there's actually several different parts of it, but it's the anterior pituitary is what we're specifically talking about. And that produces what we call gonadotropins, and these are LH or luteinizing hormone and FSH follicle stimulating hormone. And this is what controls what happens at the level of the ovaries in terms of growing follicles and causing ovulation. And the reason it's important to understand all these is this is how you can do things to manipulate the cycle to our advantage. So mares have a very long follicular period, and because of it, they have a huge range of diameters that they can ovulate a follicle on. So it can be very challenging to try to breed them very precisely without using drugs to cause them to ovulate. And then, the follicles as well as CLs, they produce other hormones such as progesterone or estrogen that have feedback up on these hypothalamus and the pituitary gland to modulate these gonadotropins as well. And this other schematic, this is kind of showing you the ovary, I'm sorry, the ovary of a mare. And a mare's ovary is a little bit different than other species. People tend to say it's inside out, but it has the medulla layers on the outside and the cortical layers on the inside. And what this means is that the follicles actually develop interior and ovulate through a specific area called this ovulation fossa. And this is why frequently people will say you can't superovulate a mare, is because there's a physical limitation on how many follicles can actually ovulate through the ovulation fossa. And it basically goes through, this is just showing you the progression of what occurs in terms of follicles. So you'll start with a primordial follicle, which these can only be seen under a microscope, and they'll grow to a primary and secondary. And then when they become a tertiary follicle, this is what actually you're seeing with your veterinarians using an ultrasound. These are the large fluid filled structures and can get, quite large, seen up to 80 millimeter plus diameter follicles. And then when they ovulate, they actually form the remaining tissue in there. The oocyte is released through the ovulation fossa, and the remaining tissue kind of luteinizes in and becomes a corpus luteum. And as it ages and regresses, it becomes a corpus albicans, which is basically non-functional. It's almost like a little scar on the ovary. This is just showing you the hormonal pattern. So basically, day 0 is ovulation, and then you have day 21 is ovulation. And this is showing you sort of what's happening. So after they ovulate, the CL starts forming, and you get a rise in progesterone. And then it basically goes through a plateau period. And then somewhere around 14, 15 days, you get a release of prostaglandin F2 alpha from the uterus, which causes that CL to regress. And then when it regresses, you get a drop in progesterone. You have different spikes in FSH, and this is going to cause follicular waves to develop in a mare. So generally, mares have two follicular waves. They'll have a wave here that's during diestrus, and those follicles basically regress because you have that high progesterone that has a negative feedback on luteinizing hormone, so therefore, you don't get any ovulation. So those typically will regress. And this can actually cause some problems for your veterinarian in that if they have a very large diastrous follicle, sometimes giving prostaglandin can actually cause in a small percentage of mares for that follicle to ovulate. And it's also something to be cognizant of that just because they have a large follicle doesn't necessarily mean that they are ready to be bred. They can have large follicles during diastrus. They can also have them during pregnancy. So then after, that progesterone starts dropping, this is where we get, our follicular wave growth of what will eventually be the follicle that ovulates. And generally follicles grow in a cohort of multiple follicles at a similar rate. And then during this growth, there's a period which we call deviation, where one follicle continues to grow and the others start to regress or plateau in growth. And that's due to inhibitory factors secreted by what becomes that dominant or ovulatory follicle. During this period, you start getting estrogen being produced by that large dominant follicle, and that's causing a positive feedback on LH, which induces that LH surge, which is what causes ovulation. So I know this is a lot of information, and hopefully you guys can go back through and kind of look through this a little bit. And there's also, and I'll have a slide at the very end on some different resources that you can use to learn a little bit more about this if this is something that you are interested in. So as I mentioned, mares are seasonally polyestrous. And this is important because we're kind of limited to during the breeding season when we can actually breed them. And we can actually manipulate that as well with things such as lights. Is probably the most effective way that we can actually bring them into their basically breeding season sooner versus their regular breeding season. So generally in winter, the majority of mares are in estrus. There is a small subset of mares that seem to cycle year round, but the vast majority will go into anestrus in the winter. And then in spring, they basically start transitioning to becoming cyclic. And during this period, this is where it's very easy to get in trouble breeding mares because if they have not ovulated, a lot of times they'll grow large follicles, which will regress. And a lot of times they are not responsive to drugs to induce ovulation. So for me, a general rule of thumb is I like to breed mares after they've gotten the first ovulation of the season done, because then they become very predictable and manageable from a breeding management standpoint. But trying to breed on that first transition ovulation is very unpredictable, and frequently it quite honestly it'll make me look dumb because sometimes it works out great and a lot of times they just doesn't work and you breed them here several times and they fail to ovulate. So in general, it's better to wait until they get that first ovulation done. And then by that definition, they are basically cyclic at that point. And then you can manage them as you normally would. And then in fall, they actually start transitioning back into anestrus. So a lot of times you'll see anovulatory follicles during this period of time. And sometimes the follicles will grow and they just fail to ovulate. And basically, this can be managed by using lights. If you want to bring them, basically the rule of thumb is about 16 hours of light, and you want to start at about 2 months before you want to start your breeding season. So if you're aiming for, around that February 14th time period, I would put them under light somewhere around Thanksgiving as a general rule of thumb. And this is kind of depicting their seasonal cycle, and this is for the northern hemisphere. And it basically shows, if you start with your normal breeding season, and this is not with lights, this is just what they would normally do on their own, somewhere in March and May. And this depends also on how far north or south you are. If you're in Florida, you're likely to come in a little bit sooner. If you're up in Canada, it might be a little bit later in the year. So there's going to be a little bit of variation with where you are located in terms of northern, southern, which part of the hemisphere you're in, how far north you are. And then, come fall, you might have a little bit shorter breeding season in the very far north compared to somewhere like Florida because the light differences can be quite extreme in that period of time. But then they'll go through a fall transition and then go back into the anovulatory season. And this is just showing you that when they go into their natural breeding season, they basically go into this circle where they have the follicular phase or estrus phase, and that's followed by, when they ovulate, they'll start the luteal phase, and they'll kind of keep going through this until anestrus hits, and they kind of spit back into this little schematic here and go through that again. All right, so some different things you might see your veterinarian use to help manage their cases. Some hormones commonly used. One is progesterone. And what we're trying to do is mimic the hormone produced by the CL to help support pregnancy. It can also help suppress estrus-like behavior, which can be problematic in some mares. And we can also use it for estrus synchronization. Doesn't generally work very well in horses, but there are some protocols that you can use that in combination with other hormones such as estrogen. Estrogen is produced by a dominant follicle. It's not used too commonly, but it is a hormone that can be used if you need a mare to display heat signs, or you can use it in combination with progesterone to try to synchronize mares. It's probably the best protocol we have is the combination of these drugs. However, it's nowhere near as good as what works in cattle. More frequently, you'll probably see them using prostaglandin and F2 alpha specifically. Some of the different drugs out there, dinoprost and cloprostanol. And this basically is used to lyse CLs. And generally, people think of this with short cycling. So you can give it as soon as 7 days after ovulation to bring mares back into heat a little bit faster. And just, particularly if you're trying to keep a tight breeding season, if you have, like thoroughbreds or something where you're more, you're really trying to push for that, getting them pregnant probably around February so you can get that January baby, where that season really matters. Other drugs that we use, oxytocin is used frequently for uterine contractions. So we'll use it a lot of times. Some mares have problems with fluid accumulation in their uterus during breeding, and we can use this to help manage that fluid in combination with lavaging, or basically flushing out the uterus with fluids. And then probably one of the more useful things in my mind is either human chorionic gonadotropin or deslorelin. And these basically stimulate ovulation. And generally, the rule of thumb is if you have a follicle greater than 35 millimeters, have good edema, you can give one of these drugs, and it just really helps us time that breeding more precisely. Most mares will ovulate between 36 and 40 hours after giving this drug. So that can really facilitate trying to, to breed them once and not have to breed them multiple times in a cycle. Particularly if you're ordering, for example, cool chip semen, prices, basically every time they collect and ship on a stallion, the owner has to pay a fee, and it can range from, a few $100s to several $100s each time. So we're trying to minimize how many shipments we're trying to send out for a given mare. Or if you're using frozen semen, hopefully this can help us get a good time, breeding basically, so we can get acceptable pregnancy rates. So that's sort of a real quick whirlwind of physiology. I realize it is a lot of information, but if that's something you guys are interested in learning more about, there are a lot of resources out there. And I would suggest, it's a good place to start if it's not something you're already familiar with. Now, some general thoughts. I think, in my mind, a lot of what we do in the reproduction realm, logistics is critical because, you can have a mare timed perfectly, but if you can't get the semen when you need it, that doesn't really matter. So logistics is very important. So for me, proper planning is extremely important. And, unfortunately, as everybody probably knows in life, you can have the best plan of action, but it doesn't always follow, things don't always go according to plan. So sometimes you need to be able to adapt as things progress and make changes through the breeding season. Don't get stuck on one plan so hard that it, causes a demise in the broad picture. So I think, first of all, before breeding season even starts, you want to, have a good plan. Maybe not like this picture, of that extreme, but you want to have a pretty good idea ahead of time what your goal is. What time of the year do you want to breed? Are you looking to try to get that foal on the ground as early as possible, or maybe it doesn't matter and you can just go with your normal reproductive season and you don't have to worry about things like lights or anything like that to push them earlier into the season. Other things to think about, does your mare have a riding career? Is she showing it at an elite level or is she just hang out in the pasture? Because that might, change what you want to do with her or what techniques you want to use for getting her pregnant or producing a foal for that matter. What's her reproductive status? And what I mean by that is she, a maiden mare? Is it a barren mare? Is she had, was she, is she barren because she was electively given a year off, or is she barren because she just couldn't get pregnant? All of that kind of gives you an idea of, if you're getting into a problem or not. If it's a maiden mare, those tend to be the ones that never have been bred. They tend to be the easiest ones to get pregnant because they generally have fewer problems. But if it's an old maiden mare and that kind of gets into age, sometimes those can be very challenging because they can have other issues because they haven't had foals. When I say older, 16, 17 years or older and have never had a foal. Some of those mares can have very fibrotic cervixes, and that can cause some big headaches when it comes to trying to manage the breeding on them because they accumulate a lot of fluid. Also, body condition and general health. If you have a mare that's extremely emaciated, they're probably going to have some problems reproductively just because that is, in my mind, a luxury. And they're going to do what they can to stay alive. And they will, start sacrificing reproduction for, saving, other body systems. General health, this is referring to things like do they have, any kind of metabolic disease? Do they have good hooves? Is there any kind of lameness? Things like that. All of these, can cause stress, and stress generally is a negative impact on reproduction. And then also anatomy. This just doesn't refer just to crooked legs, but also to like their perineal and reproductive anatomy. If their anatomy is not very good in the reproductive areas, that can have a huge impact on certain conditions they might be prone to, and can dramatically impact our breeding management. And there are surgical procedures that we can do to try to help fix and correct these. Also, genetic testing is a good thing. Depending on your breed, I'm not going to go into too many details on the different genetic testings. University of California at Davis has an excellent genetics lab. But I think it's important, if you have certain breeds that you're worried about certain genetic diseases, to have your mare genetic tested to see if she is a carrier of any of these. And then that's also going to play a role in picking your stallion. For example, in warm bloods, there is a fragile foal syndrome that is a recessive gene. So if you have a mare that carries this gene and you breed her to a stallion with this gene that also has a recessive gene, you have a 50% chance that you will have a foal that has both recessive genes, and they typically die. So I bring that up because you don't want to put all this time and effort into something that could be prevented through genetic testing and end up with something like that occurring. And then, unfortunately, with everything in life, economic considerations are very important. How much money are you willing to put into getting a pregnancy? Unfortunately, breeding is, it's not always cheap. It can be rather expensive, not just from the standpoint of stud fees, but depending on, if the mare has a lot of difficulties conceiving, it may take, several treatments and things like that to clear her reproductive tract and put it in a situation that is more amendable to getting a pregnancy. Unfortunately, with what we do, you can't make any guarantees that a mare is going to get pregnant. But all of us, everybody that deals in this realm is going to try their best. But if economics are a consideration, it definitely can impede the results to some degree, just because we can't do 100% of what we would like to do. So you need to take into consideration, how much money you're willing to put into trying to get a mare pregnant, and see if it, is worth it to you. So, kind of a little bit more detail on some of these considerations. So, time of the year, if you're wanting to get her earlier in the year, you're going to want to use lights, artificial lighting. The general rule of thumb is anywhere that the horse is going to be, you should be able to read a newspaper. Granted, not many people have newspapers anymore, but the idea is, you want to have it a pretty bright light that you can go out and read something on a piece of paper and see it fairly well. With riding career, is carrying a pregnancy going to cause a significant interruption in her training or showing career? If it does, we'll talk a little bit about some of the techniques. These are some of the different reproductive statuses, body condition. Ideally, they want to be a 5 to 6 out of 9. You don't want them too skinny, but you don't want them too fat either. It's sort of, like Goldilocks. You want it to be just right. Some health concerns. Do they have any predisposed diseases or conditions? Actually, this is a case. This is actually one of my horses here that was born this year. This mare is actually completely blind. And the reason I say that is you have to, if you're dealing with certain situations like that, you have to look at your facility to be able to work with those situations because they can be extremely difficult. If you have the capability. I know we all like to think we have that capability, but these certain cases like this can be very difficult because, as you can imagine, if she can't see her foal and she has a panic attack and is running around the pasture, she could very well injure herself pretty badly. She's a very sound, safe, good mare. But these are things everybody needs to kind of consider in their own cases. If they have any, certain diseases or conditions, and if it's something that they feel like they can manage and how they would go about doing it. And that's something, talk to your veterinarian about, if what their thoughts are in the situation, how to go about dealing with it. Also, just your general healthcare considerations, making sure that they're up to date on their vaccines, their core vaccines, as well as vaccines in your area that are based on risk. This is something definitely talk to your veterinarian about this. Hoof care, developing a relationship with your farrier. Dental care is important. A lot of times, brood mares tend to get neglected on their dental care. So, but I think it's a very important thing. And any other kind of healthcare consideration that you guys can think of or are concerned about. Any anatomical issues that could impact reproduction. It could be, probably one of the weirdest ones I actually saw. It's very rare, but it was a mare that did not have any teats, even though it doesn't probably wouldn't affect her ability to have a foal. Unfortunately, when the foal, if she did have a foal, it would not be able to eat. And that could, run into a whole host of problems trying to find nurse mares or milk replacer and things like that. So these are, things that you want to keep an eye out on. Anything that could, have an impact on, the actual getting her pregnant, carrying it a term, or even lactation. So genetic testing, this is one thing I would say, check with your breed association. If you're not sure what, genetic diseases are your breed that you're dealing with is prone to. This is just some examples. UC Davis has a lot of different tests out there, and some of them are actually developed towards certain breeds. But for example, quarter horses, they have a whole host of diseases, from some polysaccharide storage myopathies, HYPP, HERDA. Friesians have some diseases, warm bloods. So this is something, if you're dealing with any particular breed, do your research, talk to your breed association, develop a relationship with them, and see, if they have any kind of genetic testing that they recommend, just to make sure, when you're picking your stallion, that you don't pick somebody that, could potentially cause a foal to be born with any of these diseases. It's one of those things, it's preventable. Prevention goes a long way, in my book. So more mare consideration. So if your mare has a history of subfertility or has, been trying to get her pregnant and you're just not succeeding, I think you should talk to your veterinarian about doing a breeding soundness exam. And the kind of an outline of what this does is they do a physical and reproductive examination. So she'll get palpated in ultrasound, look at her ovaries, her uterus, see how they look, see how her cervix feels on digital palpation. They'll do a culture and a cytology, and what they're trying to look for is any signs of inflammation in the uterus. And then they'll also do a uterine biopsy. And the uterine biopsy is actually categorized based on the degree of inflammation as well as the degree of uterine fibrosis or scar tissue. And it's grouped into one of these different categories. Category one basically says that she has an 80% chance of carrying a foal to term. And then a category two has been subclassified into a 2A, which is a 50 to 80% chance of carrying a foal to term. A 2B is a 10 to 50% chance of carrying a foal to term. And a 3 is a less than 10% chance of carrying a foal to term. Now, what's important to think about with these biopsies is if the categorization was due to inflammation or if it was due to the fibrosis, because they're looking at the combination of the two. Inflammation is reversible. Fibrosis is not reversible. So if you have a mare with a lot of uterine inflammation, if you can treat the source and alleviate that inflammation, they can actually improve their chances of carrying a pregnancy to term. However, if she has a huge amount of uterine scar tissue or fibrosis, that is irreversible, and that's not going to get better with treatment. So if she's a category 3 due to severe inflammation, we could probably treat her and bring her up to a better category, such as a 2A or something like that. However, if she's a category 3 because she's got severe endometrial fibrosis, there's nothing we can do about that in terms of her carrying a foal to term. And then if the breed registry allows, then you need to consider alternatives such as embryo transfer or intracytoplasmic sperm injection um, to get a foal and using a recipient mare to carry the foal to term. So, this will just kind of change, if it's, if the breed registry allows it. If it's a thoroughbred, those are not options for reproductive technologies if you're trying to register it as a thoroughbred. But for other breed registries, these are, options. And this is something that you need to be familiar with as an owner with your particular breed registry, what options are viable for full registration. So once you have all this information, then you actually have to start getting plan. And I like this 5 steps of strategic planning. So basically, we kind of spent the first bit kind of defining what our strategic position was. And, then we're confirming our goals. And now we're kind of creating the plan. So we've got to figure out, how do we want to breed the mare? What breeding method? Do we want to do live cover, use frozen semen, use cool chip semen? Do we want her to carry her own pregnancy or do we want to use a recipient? And what are we going to do about housing? Are we going to keep her at our place or are we going to send her to a farm to manage? Also, we need to talk a little about, the stallion we're going to use, cost, and then the breed registry regulations are always critical. All right, so this is sort of a basic introduction to breeding options. So one is, you can inseminate the mare, and this could be live cover, artificial insemination with fresh semen, cooled semen, or frozen semen. And it basically we can subdivide that into the mare is going to carry her pregnancy to term. So she carries her own pregnancy. So basically, mares that are healthy and really don't have a performance career that we're worried about interrupting, this is a good option. Recipient mare is the other option. So that recipient mare carries the pregnancy. In this case, you might be doing embryo transfer. So basically flushing a mare, the embryo out of a donor mare and then putting it into, a recipient mare. And these are done, one, if a mare has a poor biopsy score and a very low probability of carrying a pregnancy to term, we can use a recipient mare. This does add considerable cost, depending on, I guess right now in the industry, there is a shortage of recipient mares is one big problem, plus the added cost of you're basically leasing a mare for the year to carry the foal. Also, if the mare has a performance career that, carrying a foal would disrupt, this is a good option if you want to try to produce offspring. And then, if you kind of go the route where you don't actually want to inseminate the mare and you want to use some of the artificial, more advanced reproductive technologies, such as transvaginal oocyte aspiration and intracytoplasmic sperm injection, this is a very good technique that's getting much more popular. And what it happens here is the mare goes to a veterinary clinic, and what they do is they go in with an ultrasound and a needle, and basically they aspirate the oocytes from as many follicles as they can. Generally, the recovery rates are anywhere from 50 to 80% of the follicles aspirated will give an oocyte. And depending on the number of follicles a mare has, dictate how many oocytes you can get potentially. And then what happens is the fluid that you recover is searched. The oocytes are found. They are then basically sorted out from all the other stuff, processed and stored in a container. And this is sent to a lab. And there's many labs, and there are more, it seems like every day, that actually do this intracytoplasmic sperm injection. And this is what this picture is depicting, where basically these eggs arrive at the lab, and the lab needs to already have the semen there. They can't wait on it. It needs to be there well ahead of time. And generally, they'll use frozen semen for this. So if you're going this route, there definitely needs to be some planning ahead of time. I'm not going to talk too much about it on this talk, but I did want to touch on this right now. But you want to make sure that the frozen semen is there ahead of time because these eggs mature in about 24 hours. They cannot be stored. We cannot freeze horse eggs for any long period of time. So this is stuff that needs to be done now. This is not stuff that can wait. And then basically what they do is they use a pipette to immobilize the oocyte, which is right here. And then they use a needle to actually inject the sperm into the cytoplasm. So what we have here is this is called the zona pellucida, which is sort of a covering. You have the actual oocyte here, and this is a polar body, which is sort of like extra DNA that the oocyte doesn't need. And this can be used if you have mares that have some sort of health reason that you can't breed them, or if you have really poor semen quality from a stallion. This is what this was originally designed for. Also, some people use it to maximize the number of offspring by a mare, because as you can imagine, if you're flushing embryos, you might get one, basically every cycle. If you're really lucky, maybe two occasionally. But with this, if you're aspirating, say 20 eggs and you get 10 oocytes, you might get two or three embryos per cycle. That really depends on how many eggs you're able to retrieve from an individual mare and how many embryos can actually mature. But some cases people will get 10 or 12 embryos from a single cycle. Other cases you don't get any. But people will do this because they can do this every 2 weeks and they're trying to maximize the number of offspring from that particular mare. Also, good mare with a performance career. This is also another really good option because she just, rather than being disrupted for, basically a couple of weeks for embryo transfer, she just goes to the vet clinic one day, her ovaries are aspirated, and she's done. All right, so management location. So one question is, do you want to send the mare somewhere to be managed to be bred, or do you want to do it yourself? And some things to think about, if you're going to a facility, is to make sure she's up to date on her vaccinations, her Coggins. Also, how much is it going to cost? What type of board? Are they going to be on stall board, pasture board? Do they have, like paddocks? What's the disease risk? Because, if they go somewhere, like this, there's mares and other horses coming in from a large number of areas. Do they have a quarantine procedure? What's the risk of injury? If she's out on a pasture with new horses, obviously the risk of injury is much more than if she's kept on a stall. But, also the cost is going to, be substantially more for a stall. On the converse, you can manage them at home, but you also have to think about, access to your veterinarian. What kind of facilities do you have on the farm for doing breeding management? A lot of veterinarians like stocks. Some may not be so picky, but, do you have adequate facilities for them to palpate the mare? Or do you need to transport the mare to clinics, to a clinic to be examined? If it's transporting to a clinic, do you have time to take off for these exams, and things like that? Also, there's a cost associated with it. If people are making farm calls, if you have one mare and it's a very out of the way drive, you may, expect to charge a little bit more for the veterinarian's time, just because you are out of the way. Or if you're transporting the clinic, you have to take into consideration your fuel costs and things like that. Also, when you're doing, the home situation, is you have to think about the semen logistics. Where are we going to, if you're doing cool chip semen, where are we delivering the semen to? Some locations are harder for FedEx to deliver promptly. Generally, if these are delivered overnight, so you need to get it there. If it takes more than one night, that's usually not good. The sperm, after a couple of days, tends to die. And is somebody there to actually receive it? And things like that. So this is, to me, a very critical area. You could try saying, could you have it sent to your veterinarian, or do you want it sent to your house? But these are things that you need to take into consideration, are a lot of logistics. So a little bit on sign selection. I'm not going to tell anybody how to pick their stallion because I think a big part of this is based on what you like as an owner, the cost, the availability, and things like that. Just some small points. I think being aware of any genetic disease carrier status is important. So you can look at your mare and see what her status is to make sure you're not going to, have problems with that foal as a result. Also, taking into consideration your mare's reproductive condition or history. If you have a maiden mare, pretty much everything's on the table. However, if you have a mare that's subfertile or has a history of, being very challenging to get pregnant, frozen semen is probably going to be your lowest chance of a pregnancy. So that might not be a good choice if you're trying to get a pregnancy using frozen semen, or you just have to take, realize that if you use frozen semen in a subfertile mare, that you're going to have a lot lower chance of success. And if you're willing to accept that, that's fine, but that's something you just have to be aware of. And then contracts, fees, and breeding logistics, very important. And you can see it, I very much think everybody should be very familiar with their registry rules, because this is going to really dictate, what you can do in terms of live cover, cool chip semen, or frozen semen. So, but you want to make sure you get all of this stuff filled out ahead of time. I think that's pretty critical. And we'll kind of say it again, contracts and fees paid. I recommend, before you ever, have your mare examined by your veterinarian for that first time in the breeding season, to have all your contracts and fees set up and paid and everything arranged. If you have to have your transportation arranged to the breeding shed, or do you need to have it arranged to get to the veterinarian or the farm that's going to be managing her? Make sure you understand the day-to-day care. Are you doing it? Is somebody else doing it? Have it already established with a veterinarian. Are they coming to your farm? Are you going out there with them? Sorry about my cat in the background. Also, if you're going to a breeding shed with live cover, make sure you know what the farm's requirements are. A lot of the farms may require culture cytology, they may require certain vaccines, or Coggins health certificates and things like that. So just make sure, before you really ever have your veterinarian, even check out your mare, make sure you have all of this covered. This stuff is, in my mind, actually very important. And we see a couple of cases every year where these things are not in place, and it comes back to kind of haunt the owners to some degree. If you're breeding with frozen semen, you want to make sure you purchase it and have it at your vet. Make sure first that your veterinary can store the frozen semen. Some may not have the vapor shippers or containers, which are these to store it, but make sure that they do have a way of storing the semen. And then have the semen shipped directly to your veterinarian before you ever plan to get your mare there. It's better to have it sitting there than waiting on it, because if the mare's there and we don't have the semen, I'll be honest, I'm not going to do anything with the mare, because it doesn't make any sense to hope it arrives tomorrow. But then if the mare's ready to be bred tomorrow and it's not here yet, that's a horrible situation that I don't want to be in, because then it's just a waste of everybody's time and money. So the moral of the story is make sure it's there ahead of time. If you're using cool chip semen, before you ever see the vet, make sure you have your contracts and fees paid. Also, you need to know what your stallion collection schedule is, and it's good to communicate that to the veterinarian, because that may dictate, if they want to check on a Tuesday or Thursday or a Monday, Wednesday, Friday, so they can have a rough idea that, what day is going to be the best to order. And then also, you need to know how much notification is required for collection. Most places it's 24 hours, but I've had some that wanted like a 3-day notice, which is a little bit crazy, but you just have to work around it. And then, do they need to have confirmation? A lot of them want you to call the morning of to confirm. And but we want to make sure, do we need a confirmation? And if so, by what time? And then make sure that we get the contact information for the stallion is accurate and up to date. Sometimes owners give us information, and it is incorrect. And when you go to contact the stallion owner, it's not the right stallion, or it's just a completely wrong number. So that always needs to be up to date. And also shipping, if this is international, that can have a huge impact. Cool chipped international can be kind of a pain. So a lot of times you may opt for frozen semen in those situations. And then, can you get delivery? Is if it's being shipped on a Friday and it's going to get delivered on Saturday, is that going to a location where it can be delivered? Or do you need to have it like holding at the FedEx office so somebody can go there and pick it up? So these are all things to think about. And even if you do everything perfectly, sometimes FedEx has problems where it gets held up at a distribution center and it doesn't get there on time. It's always very aggravating this happens, but these are one of these things out of everybody's control. But hopefully, we can try to minimize accidents happening if we kind of have all this stuff set up ahead of time. So, kind of rehashing important points. I can't emphasize enough to have your breeding contracts and fees finished and paid before the mare's ever examined. If you're using frozen semen, it should be there to your veterinarian before that mare is examined. Communication is critical. A lot of times, veterinarians, we get very busy. So, please give us a phone call if you have questions. We'll try to communicate as much as we can, but sometimes we get hung up by emergencies and things like that. And I think it's important, that, your veterinarian is going to try their absolute best to get your mare pregnant, but unfortunately, there's no guarantee that she will get pregnant. And then if you take shortcuts in breeding management, generally that's not going to equal success. Sometimes you get lucky, but I think good management is, better than luck, and that's going to give you the best chance of getting a pregnancy. So this is a little bit of an example of why, and this is actually from cases we actually had probably like 3 or 4 times this happened this breeding season alone, where you had a situation something like this where mare is brought in for breeding management. It's midsummer, so she's cyclic, and you look at her and she's got a nice large breedable follicle, this 40 millimeter follicle on this ovary, and she had very heavy edema and open cervix. So this person, when she they were lucky on one hand, and when they brought her in, that she needed semen to be ordered. But we talked to the owner and they didn't have a contract filled out, and they called the stallion to see if they could get it to work out, where they could ship semen, the next day. But the stud place basically said, no, we're already booked up. We can't do it. You're just going to miss this cycle. So unfortunately, in this case, this mare ended up ovulating on her own. We were unable to breed that particular cycle. And, what happens is just added time and expense for the owner of the mare. It's very unfortunate, but I think a lot of these situations can be avoided with good planning, and communication. Making sure that the contracts and everything are filled out ahead of time, because nobody's going to send semen on their stallion if they haven't had their stud fee paid. So breeding management, what to expect. So a little bit away from the logistics and kind of just a little bit touch on some of the things that may happen with breeding management. So really, transrectal palpation, ultrasonography are the tools. They're going to look at and evaluate the cervix, the uterus, and the ovaries to try to figure out where she is in her estrus cycle. And then, if everything looks normal, they may breed on that cycle. But if they have anything that they're worried about, they may opt to do some kind of diagnostics to rule out any kind of treatable cause of, potential infertility. These could, be as simple as like an aerobic culture or a cytology. The aerobic culture, they'll put on a plate, see what bacteria grow, and then they can do a sensitivity to try to figure out what might be the best treatment course. Cytology is an example of histology. What they're doing is they're looking for neutrophils, which are these cells. They're inflammatory cells, which suggests that this mare has an acute infection. And then based on this, they'll develop a treatment plan. And these may also be done not just if you suspect a problem, but for example, if you have a mare that's being bred to extremely expensive semen, me personally, I might want to go ahead and do these diagnostics because I want to try to get her pregnant the first time. Case in point was a mare. She was being bred with frozen semen. Each breeding dose was $3,000. We had 3 breeding doses. We did these tests. She did have a little bit of a uterine infection. We treated it, and we were only able to use 1 breeding dose to get her pregnant that first year. So the owner still had 2 more breeding doses that they could use in subsequent years. If we hadn't, there's a good chance that we may have bred her and she failed to get pregnant on the first one. And then we did all these diagnostics and found a problem, treated it, and she may have gotten pregnant with the second one. But in that case, rather than spending $3,000 on semen, you're spending 6,000. So sometimes, you can spend a few $100s in tests and with the hope that we can save, thousands of dollars in other costs. And then again, kind of going back to some of these things, we might use luteolytic agents such as prostaglandin F2 alpha, ovulation-inducing agents such as HCG and desirelin, or oxytocin, things that utilize uterine contractions for fluid management. And there's a lot of other medications and treatments that we may use, but this is sort of the rough outline of what might be done. So, what to expect. I always like to know if I breed a mare, what kind of semen is going in the mare, because if I don't know and the mare doesn't get pregnant, I don't know where the problem is. I don't know if it's a stallion problem or a mare problem or a management problem. So, if you're breeding with live cover, it's good to get a dismount sample. You can't do an extensive analysis, but at least you can get an idea if motility is decent and if you may or may not look at sperm morphology. And this is basically just showing you what sperm look like. If you're using artificial insemination, you can how much you're inseminating. You can look at the concentration when you receive it. You can look at, some people look at the viability. I like to, and you can look at the motility, and you can also may or may not look at the morphology. And in this case, you can actually calculate how much sperm the mare actually received to see if you felt like she got an adequate breeding dose, or if you might change your breeding method, if you might go from just a normal artificial insemination to a deep horn artificial insemination, hoping that you can try to, maximize your pregnancy rates. All right, so you go through all of this work, and then we get to the pregnancy check phase. And this is showing you roughly a 14-day pregnancy. They're just a little vesicle. So I always recommend a 14-day pregnancy check to determine if they're pregnant or open. Big reason is you want to check for twins. Depending on the breed, certain breeds like thoroughbreds and warm bloods have a higher incidence of double ovulation. It can be up to around 25%. And at this time point, this is easily managed. Unfortunately, twins generally doesn't work well for mares. That foal needs the whole placenta in contact with the uterus to receive sufficient nutrients for them to grow and develop normally. If they don't have that sufficient nutrients, they tend to come out small, or they may actually lose the whole pregnancy. Prior to the use of ultrasonography, twins was the most common reason for pregnancy loss. Since it's advent, we can now recognize it and manage it by reducing one of the twins. This 14-day time period is the best time because the embryos are still mobile and can actually just be very easily, one can be crushed. Once we get to 16 days, they become fixated. If they fixate next to each other, you really run a high risk of losing both twins when you try to reduce one. So the 14-day is, my recommendation. Always get them checked at 14 days. The next one is a 25-day check, and that one we can actually look for fetal viability to make sure they have a heartbeat. Occasionally, and luckily it's very rare, you can have basically a little embryo develop with no actually little embryo proper. So it's just basically a little fluid filled bubble. Mare thinks she's pregnant, but there's actually no foal that's going to develop in there. And that's what we're looking for here. Also, you could have, an embryo that malforms or does not have a heartbeat. And sometimes these can actually get carried on for much longer. So if you identify these sooner, you can terminate that pregnancy if it's abnormal and start again. If everything hopefully looks good, then a 40-day check and a 60-day check I like to recommend, just because these, before 60 days is where you have the most of your pregnancy loss. And if you recognize it sooner, depending on where you are in terms of time of the breeding season, there may be a chance or an opportunity to have enough time to actually breed her back before it's too late. And then I always like to recommend checking again in the fall, just to make sure that before she's getting ready to foal, that nothing has happened where she's lost a pregnancy and we're just kind of waiting around for her to foal and it's never going to happen. And just a note, if you're using doing an embryo flush, generally this is done between 6 and 9 days post ovulation. That timing, you can talk to your veterinarian and they can decide what's going to be best based on her age and what you want to do with that embryo, if you want to freeze it or if you want to transfer it immediately to a recipient mare. But that's something I think is a little bit beyond the scope of this talk, and it's something you can talk to your veterinarian about in particular. So, a lot of times you run into this, okay, my mare's open, she's not pregnant. I thought they always got pregnant. Well, the reality is this is sort of your expected pregnancy rates depending on how you're breeding them. So for live cover and cool chip semen, you're looking, roughly around 60% pregnancy rate. So if you breed 100 mares, about 60%, 60 of them are going to get pregnant. You can see it's much, much lower for frozen semen. It's about 30%. So this is something you need to bear in mind. And this is when I said earlier, if you have a mare that's subfertile, frozen semen might not be the best option because you can see we're already starting with a much lower pregnancy rate in normal mares. And if we're dealing with subfertile mares, this is going to be significantly lower. And kind of it gets broken down to these three factors. The mare factors, what intrinsic factors is she having? Does she have a uterine infection or things like that? That could be a problem. Management factors, is everything, are we doing everything the best we can from a management standpoint? And stallion factors, is that semen quality adequate? And, a lot of times, mare owners want to blame stallion owners want to blame mare owners, and, that doesn't really get the job done. So you have to kind of look at all of these different things to try to figure out what's going on and what we can change to try to, get the mare pregnant. So what's next? You basically two decisions. Do you want to quit or do you want to keep trying? And this boils down to, a combination of economics, time of the year, things like that. I think this is where communication with your veterinarian is extremely important, to try to figure out, what kind of reasons could be happening. A lot of times, more diagnostics might be requested, should, do a culture or cytology. I've hit cases where, you had a mare that you cultured with a uterine swab and nothing grew on culture and there was nothing on cytology and bred her. She did not get pregnant. I cultured her again, but this time I did a low volume lavage. So basically put a little bit of fluid, dispersed it through the uterus, and that actually did grow something on culture. We treated the mare and she did get pregnant. So, just changing your diagnostic technique might be indicated to try to, figure out what's going on. And in this case, what can be done differently? Do we need a different diagnostic technique? Something like that. But, you always have to take into consideration cost, unfortunately. But, this is one of those things. I love this old saying by, of all people, Vidal Sassoon, but the only place where success comes before work is in the dictionary. So, a lot of times when you get in these pregnant, these mares that are very difficult and these problem mares, a lot of times you do have to put a lot of work into trying to get them pregnant. But if it's a quality mare, I think it's totally worthwhile. So, okay, my mare's pregnant, you know. So, again, that 14-day check was positive. That is great news. But I think following up with 25, 40, 60, and a late fall check is very good to identify pregnancy loss. Identifying it as soon as you can is important for rebreeding. It also, if she did lose the pregnancy, that might change, what you're feeding her in terms of nutrition. She probably isn't going to need as much nutrition as she would have if she was pregnant. And then that'll also allow you, the next year to try to figure out, if you want to breed her again the following year, when you want to get started and what you want to try to develop a plan with your veterinarian for how to address, what's going on or, try to figure out why, the pregnancy was lost. And that might be where you start considering like a BSE, a breeding soundness exam, and doing a biopsy or things like that. Also, if you have a fetus that you actually, is on the ground that was aborted, you may consider sending that out to a diagnostic lab to do a necropsy to try to figure out why she lost that pregnancy. And then, you also want to know a rough prediction of her foaling date. Unfortunately, mares have this huge range of gestation times. Its average is about 340 days, but you want to have a rough idea of when she's due so you can start knowing when to kind of keep an eye on things. And also during this period, you want to be, cognizant of feeding, deworming, and vaccines. And this is where you want to talk to your veterinarian about really setting up that vaccine schedule during that full, while she's pregnant, because that can be very important to try to prevent abortions and any kind of problems like that. So, generally, nutrition, very important, deworming, farrier care, getting the EHV1 or rhino immune or pneumobort vaccines. Some will do a 3 month, but at least 5, 7, 9, 11 months of pregnancy. Also doing your pre-foaling vaccines. These should, talk to your veterinarian about, what risk-based factors you have as well as your core vaccines. And you want to do these, about a few weeks prior to her predicted foaling date. If she has a caslix present, you need to get that out. Basically, a caslix is where they suture the top part of the vulva down. So you can imagine if that is not removed when she's foaling, it will, really destroy that basically that whole back area of the mare. Also, depending on the type of breed, if you're working with thoroughbreds and say standard breds, there's a condition called neonatal isoerythrolysis. Basically, what it is the mare's colostrum produces antibodies against the foal's blood type. So, it's very rare in other breeds. However, I don't think it's ever wrong to actually screen for this because it's prevention is very easy. You just don't let the mare nurse that colostrum and you get replacement colostrum from an NI negative mare. And then basically, you can milk the mare out, and there's a test you can do to see when you can get the foal in nursing on that mare. And also, blood typing may be useful if the mare has some kind of postpartum hemorrhage and you need to do any kind of blood replacement. This can be very useful to facilitate trying to get the right blood faster. But these are two things, again, with this NI, the negative thing is if once the foal ingest that colostrum and those antibodies start destroying the red blood cells, it's very, very expensive treatment. And generally, the foal does not make it. It usually is going to succumb to the disease. So it's one of these things that's extremely preventable. The screening is a few $100s, where treatment is, several $1,000s, and more than likely it's going to have a poor outcome. So lastly, I think, everybody, most people are going to be probably registering their foal. I think, it's very important for you to keep good records for your breeding dates, ovulation dates, foaling dates, to have that signed and dated service contract from the stallion owner or agent. But again, this is where you want to really communicate with your breed registry. Make sure you're familiar with the bylaws. Ask your breed registry for any questions you have on registration details to make sure that all gets done properly. Here's some different resources. AAP is an excellent resource for your equine veterinarians. Your breed registry, other breeders are good resources. There's also a lot of very good books out there that you can use to try to beef up your knowledge base. And with that, I'd like to thank everybody. And if anybody has any questions, happy to try to take a few.
We do have a few questions, and I think most of them can be answered pretty quickly. So, is there any studies that have shown a difference in foal gender results when comparing live cover versus cooled versus frozen semen?
I am not aware of any. What you can do, so in certain disciplines, for example, polo ponies really like females. They do make, or they are working on some stallions having sex sorted semen. It's not perfect. It's, basically like 98% chance of getting a particular gender. So sometimes things can slip through the cracks. The other thing you can do is around 60 days and again around 120 days, you can actually fetal sex the fetus to figure out if you're going to get a colt or a filly. But I don't know of any relationship between the type of semen and, whether it's a male or female.
Okay, here's another question. Are there any therapies such as Beamer, PEMF, red light, etc., that should be avoided or started before or during the pregnancy?
Generally, I think just, and it does sound like feed supplements. I don't know if I'm familiar with those exactly. But, my recommendation for most mares is, just give them adequate nutrition, just good health care, make sure they're getting a good balanced feed, good high quality hay, getting their proper vaccines, health, deworming, dentistry, all of that. I don't think there's any, most mares aren't going to need therapy. Some that do, and this would be on a case by case basis, would be progesterone supplementation. Your veterinarian may recommend it based on that particular case, but most normal healthy mares don't really need anything special.
But as far as like laser, ultrasound,
No, I
um,
mean, if that might, you don't need anything like that for a normal healthy mare, unless she's got some other ongoing condition that your veterinarian wants to work with, like a lameness or something.
cool. If you're short cycling a mare, how quickly do you expect them to come back into heat and be ready to rebreed?
Yeah, so it's unfortunately with mares, there's a bit of a range, and it can be anywhere from 4 to 10 days. And a lot of that depends on how large, because she has that CL, a lot of times they have follicles, and that a lot of times will depend on how fast they come out, how big the follicle is when you short cycle them. So if she's sitting on like a 25 or 30 millimeter follicle, more than likely, there's no guarantee, but more than likely she'll come in faster than a mare that's sitting on a 10 millimeter follicle.
At one point, you were talking about checking the mare for pregnancy, and there are so many days between, and then you say fall. And this question is when you say fall, check on pregnancy, is that for a mare bred in February ish?
Yeah, so if the mare was bred earlier in the year, I'd probably check her like November, December if you're expecting her to be born like in January or February. If, I would probably say, like 2 months before when you would expect her to be due, 2 or 3 months before, what you'd expect her due date to be, just to make sure that, you're managing her properly, that if she's an open mare and she's supposed to be pregnant, but she's open, that you're not managing her like a pregnant mare and overfeeding her.
Okay, here's a good one. And this is going to be hard. Do you have a resource specific for donkeys?
Oh, there's more research coming out now. but that is an area that's actually been rather neglected in the equine reproduction realm. One of the books, I think, on the back part, it's a very expensive book, the equine reproduction book, the red one, and it's geared more towards veterinarians. But that one actually does have a chapter on donkeys. But I don't know of very many books specifically on donkey reproduction.
Yeah, we see more and more resources lately about donkeys, but it is kind of a thin area. Someone asks, when should I go for ICSI instead of embryo transfer for a mare that is showing? And I assume when they say showing, they mean performance, benefits, costs.
Yeah, so ICSI is very, and this is not something I can tell you when or, this is very individual on everybody's situation because ICSI is it's expensive, you know. So I think, partly depends on, what, if you're keeping the foal or selling the foal. It depends on how many foals you would like, if you just want one or if you want, 20 or 30. Those are different factors to take into consideration. The benefit of ICSI is it's sort of you can take your mare in. It's less than an hour to do the procedure, depending on the person's experience. So it's a pretty quick procedure. And then if you just want one foal, you may only have to do that once. But your costs per foal can range anywhere from $10,000 to $20,000 just for all the procedures and everything. So it's a fairly expensive, and they do charge you. A lot of the labs will charge you on how many embryos they make. And I knew one client, I think he was expecting to get like two or three, and ended up getting 30, and he was like, "Oh my, this is going to be a lot more money than I thought I was going to spend." So that's something you have to think about because there's no guarantee that you'll get an embryo or you may get more embryos than you expected. With embryo flushing and transfer, you know, you basically are going to have to take your mare in. She's going to get managed like any mare would for breeding. So she's going to have to go in, for several checks. And then after she ovulates, she's going to go back in 7 days later and they're going to flush her. And then, if they get an embryo, then that's going to get transferred to a recipient mare. So it's going to take a lot more time. So, those are different factors. And depending on, how heavy the mare's show schedule is or her training schedule, it can kind of drive you one way or the other, as well as, just the sheer expense differences. Because, doing an embryo flush will probably cost you, a couple thousand versus, a few like 10,000s or more, So those are, a lot of things to take into consideration. So I can't really tell you which one is going to be better because it just depends on your situation.
Deworming protocol. That was the question.
Yeah, so I mean, I can't give you any, this is something talk to your veterinarian, what they recommend for the area. Generally, I think it's good to do your fecal tests and treat based on that. And a lot of that's going to depend on time of year, but I'd say, talk to your veterinarian about, developing a good deworming protocol for your area, because every area is a little bit different in terms of parasite resistance to anthelmintic. And, I think that's something you should, really talk to your veterinarian in that area because they have a much better sense than I do.
Here's a question. I'm not sure what it's in response to, so I might need more information from the questioner. The question is just, would drug dosage change depending on the size of the mare? In other words, an 1,800-pound draft horse versus a 1,000-pound thoroughbred.
Yeah, I'd say with the larger horses, I don't tend to change my drug dose as much, but when I start dealing with like miniature horses, I kind of drop down my drug doses a little bit. Um, I find, horses are pretty sensitive to say prostaglandin. So, in most mares, I'll use like a mil of cloprostanol. However, if I'm doing like a little miniature pony, which, they're very tiny, I tend to drop my dose down to about half of that because I don't want to cause any more discomfort or anything like that.
Okay, and you all, I see several more questions on our list, and I'm going to close the questions at this point. We'll try to get through the rest that are here, but I see you guys sneaking in more and more questions. Is there any truth to older mares being easier to breed in the fall versus the spring?
No, I personally think, with older mares, sometimes I feel like you get one good cycle. And so I like to try to start as early as I can, because if you're starting late and you missed a good cycle or she has problems, you might just miss the whole season. So I start early and, hope for the best. And I figure that gives me a little bit more wiggle room to get the job done if it doesn't go right the first time.
Thoughts on breeding on foal heat?
Yeah, so I am not opposed to breeding on full heat. However, there need to be certain criteria met for me to do it. And I'm not going to go into details of why, these criteria, but basically, I want to have a mare that had a normal foaling. So if she had a dystocia or difficult birth or retained placenta, I will not breed on that full heat. If she has fluid accumulation around the time of breeding, I will not breed on that full heat. And if she ovulates, I want her to ovulate 10 days or more after foaling. If she ovulates before 10 days, generally I don't like to breed on it because she's going to have much lower pregnancy rates. But if, she ovulates 10 days or more after full heat, there is no uterine fluid and she had a normal birth, I am good with breeding on full heat.
Why wouldn't you always do deep horn with AI?
So one, I personally do deep horn with pretty much all my AIs. But there's a lot of veterinarians that may not be comfortable with it. They may not have a high reproductive caseload. It's a little bit more skill to it. Um, so, the idea is you get a little bit higher pregnancy rate with deep horn with lower numbers of sperm. However, if you're shipping, a billion sperm, it's not really necessary. You don't really get any increase in pregnancy rate. But if you're breeding with like 250 million sperm, so like with frozen semen, I think deep horn is advantageous. But you also have additional semen processing for deep horn because you don't want to put 60 mils in the uterine horn. It kind of defeats the purpose. With deep horn, you're really putting in less than 5 milliliters, so it's a much smaller volume. Um, so, it kind of depends on the veterinarian, but if you're, having 60 mil doses with a billion or more progressively motile sperm, it's not really needed. But for me, being at a university, I have training residents, so I want them to be comfortable doing it. So we tend to deep horn everything just so they get the practice and experience. But it is a little more technically challenging, and some people are not comfortable with it. And if you have adequate semen, it's really not necessary.
Is ICSI more successful when a mare is cycling versus not cycling?
They just need follicles. They really haven't pinpointed, to my knowledge, when the best time to get follicles is. There's really two different approaches. One is to get the dominant follicle, and you only get one oocyte, and the other is just to aspirate everything you can find on an ovary. And really, I think the trend has gone towards aspirating everything you find on the ovary. You tend to get more embryos from that. But as far as I know, there's really nobody's found any ideal time point, like during estrus or diestrus or anything like that. Really, it hasn't shown anything to be, substantial there.
And this next one, if you would pull up the previous slide, because we have a question, which book on equine reproduction would you recommend for a veterinarian looking to get into equine breeding?
Oh, I would go with the equine breeding book. It's actually, where is it?
It's the slide
We'll go
before the
back.
one that's
Yeah.
currently on.
Let's see if I can figure out how to. Oops. Yeah, I'm not a technical genius. I apologize. Let's try sharing again.
You
Here we
actually
go.
are sharing.
Oh yeah, I'm sharing the wrong screen. That's what
Yeah,
I'm
it's all
doing.
right.
Here we
Just
go.
back
This
up.
book
There it
right
is.
here, it's a two-part series. A little pricey. I got a while back. I think it was published in 2013. But it's probably the best, most comprehensive one on it. But it'll run you a few $100s, and it's a two-volume series. It's the second edition. The first edition was like one book. The second edition has expanded and goes into quite a bunch of neonatology as well. But this is probably the best one for a veterinarian.
Can you
Um,
Can you tell us an author on that? It's hard to see.
Oh yeah, it's McKinnon, Squires, Vala, and Varner.
Okay. All those names. The Red Book.
Yeah.
Cool. Um, are there any negative indications of breeding a mare that has tested positive for lepto but has been treated and now has titers?
I have not. My mare, the blind mare, she actually was positive for lepto. That's why she was actually boarded somewhere while I was doing my residency, and she had lepto and got uveitis and went blind. And I've had two healthy foals with her the last couple years. So I'm not aware of any, if she's had a previous lepto infection, that being a problem.
Well, that's good news. What are your recommendations on choosing a stallion for a maiden mare? Or what are things you would avoid in choosing a stallion for a maiden mare?
Yeah, luckily in the equine realm, large foals tend not to be as much of a problem in cattle. So, I don't, for me personally, like, I don't really, I just try to pick the best stallion based on my budget for my particular mare, based on her attributes. Unfortunately for, us horse breeders, cattle breeders, they have like calving ease and these expected progeny differences that they can look at to try to pick for things like that. But unfortunately, we really don't have that. So, but dystocia is a lot less prevalent in horses than it is in cattle. However, when we have it, it tends to be a lot more severe cases. I know that didn't make anybody feel better, but so generally, I don't really make any special selections on that because we don't really have any adequate way of doing it. So I really just try to pick the best sire for the mare, and then I just try to make sure that the mare is attended during foal in case there is a problem. And I try to make sure that I either have, if you have a veterinarian, make sure that when it gets close to foaling, if they do emergencies, I would recommend calling them, like say, hey, my mare is due on this time. I wanted to give you a heads up because if I have an emergency, I'd like to know what to do. And they could say, okay, call me or take them to a specialty clinic if there's one nearby you or something like that. So that's what I would do is more of have a game plan for when foaling occurs. If something bad happens, of how you're going to deal with it in terms of either having a veterinarian there, giving the heads up and just saying, hey, I think she might foal this time period. Would you be able to see it? And if they can't, what kind of arrangements can I make? Versus, just kind of throwing it out of surprise in the middle of the night. Because they may say your best bet's going to be to go to a particular hospital that's nearby to be managed. And in those cases, I can tell you when I was an intern in Kentucky, a lot of those farms, if they had a problem, they didn't wait for the veterinarian to come to the farm. They just loaded it up and took it to the referral clinic because time is of the essence there. But, I would recommend talking to your veterinarian and developing that plan ahead of time.
That is such a good point. And we actually had an entire webinar on emergency situations, and so much of it is just preparing ahead of time. And again, this is a reminder that you should have a vet that you're working with and have that relationship with them, um, so that when you do have that problem, you're able to get help right away. If you don't have a working relationship with a local vet, it's going to be very hard to find somebody when you have that emergency. Most of the other questions we've already answered, or they're pretty broad and things you can find out from your local vet. There is one question: what about older mares who don't show to a stallion? Older mares who don't show to a stallion, do they still cycle?
Yeah, some mares when they get real old may not. But your veterinarian, if you're concerned about that, they can do routine reproductive exams and see what she has on her ovaries and what if she has any uterine edema and what her cervix is doing to try to stage where she's at in her estrus cycle. There are some mares that don't tease even when they're in heat. Probably one of the more frequent times you might see that as a mare with a foal. They may be in heat, but they may not tease because they're trying to be defensive of their foal. So in those cases, you may not be able to tease to figure out when they're in heat, but you may have to have your veterinarian do a reproductive exam, and you might have to do several exams to figure out when they actually come into heat.
And one more, I think this question was probably asked right before the other one. Someone asking, what book would you recommend for a vet tech helping a veterinarian with equine reproduction? I bet you're going to go to that same book.
That's a really good book. Another really good one is The Manual of Equine Reproduction. It's a lot shorter and more direct to the point. It's by Charlie Love, Dixon Varner, Steve Brinsko, and I think Terry Blanchard are the authors on that one. There might be some other authors I'm missing, but I believe those are the authors. But that's a little bit less expensive, a little more succinct, and I think it's a pretty good book for breeding management.
Oh, a great recommendation. And I'm so impressed that you remember every single author's name. That's,
Well, I'm lucky. I actually got to work with most of them,
oh, well, very
so that
good.
helps.
So yeah, I think we're going to call it at that. We got through all our questions, and thank you all for those questions and for understanding that we can't answer specific to your horse kind of questions. Dr. Kelley, thank you so much. This was a great session. It made so much sense, and I think it's going to avert some problems when people are trying to get their mares bred. Yeah, let's see those reactions in the chat. I like seeing those hearts.
Yeah, I just
And
want to, if
go
I
ahead.
can, just thank everybody for being here, and I hope you guys enjoyed it.
Absolutely. And a reminder that this recording will be available to you probably tomorrow if I don't have any technical issues. And once the recording is available, I'll send you an email and give you the links to that. And I'll include links to the other horse owner webinars as well. So thank you so much. Um, I am going to toss my email in the chat just in case anyone wants to reach out to me with questions. And otherwise, this is the very awkward part of every webinar where I just kind of hang up on everyone. There's no good way to go out. I just hit the button. So thank you, thank you, thank you. Dr. Kelley, thank you. Attendees, thank you so much. Horse Owner Education Committee, way to go. And we'll do more of these. So keep your eyes peeled. And if you have any suggestions, let me know. All right, here we go. I'm going to hit that end button. So, Dr. Kelley, one more wave goodbye.
Thank you, everybody.
And we are done. Good night.